Substance use disorders are chronic medical conditions involving the brain's reward, stress, memory, and impulse control systems. They are not moral failures. They are not simply bad choices. And they are not lacking in willpower. They reflect measurable biological changes. Understanding what happens in the brain during use, during withdrawal, and over time helps reduce stigma and guide effective treatment. Most addictive substances increase dopamine in the brain's reward pathway. Dopamine is not the pleasure chemical. It's better understood as a motivation and learning signal. It tells the brain, "This matters. Remember this. Do this again." That's helpful when dopamine rises from natural rewards: food, connection, achievement, sleep, safety. But many substances cause dopamine spikes that are stronger and faster than natural rewards, and the brain learns quickly. Repeated exposure alters the reward system. Dopamine receptors can become less sensitive. That means everyday rewards feel muted. Things that used to feel satisfying may feel flat. Motivation drops, and the brain begins to rely on the substance not to feel high, but to feel normal. This is one reason people often say, "I'm not even enjoying it anymore. I'm just trying to stop feeling awful." That's not weakness. That is neuroadaptation. At the same time, the prefrontal cortex, the part of the brain responsible for judgment, planning, and impulse control, becomes less effective under repeated substance exposure. That doesn't mean the person loses intelligence. It means the brain's braking system becomes weaker. Urges feel louder, delay feels harder, and decision-making becomes more reactive. Stress circuits can also become overactive. When the brain expects a substance and doesn't get it, stress signals increase. Irritability rises. Sleep becomes disrupted. Anxiety spikes, and restlessness increases. Cravings can feel less like desire and more like alarm. That is why addiction can look confusing from the outside. People may truly want to stop and still feel pulled back. Because the brain has learned, this is the fastest way to regulate. This is also why withdrawal is such a high-risk period. When the substance is removed, the brain isn't immediately balanced. It has to recalibrate. That process can include powerful physical symptoms, emotional instability, and intense cravings. In many cases, medical support is not just helpful, it's essential. The good news is that the brain can change again. Addiction is neuroplastic learning, and recovery is neuroplastic relearning. With evidence-based treatment, the brain's reward and stress systems can stabilize. Prefrontal control can be strengthened, sleep can improve, and cravings can decrease over time. In Part 1, we explored how addiction changes the brain's reward, stress, and impulse control systems. These changes can occur with many substances, but some substances carry especially high medical risk. In Part 2, we'll look at opioids, including prescription pain medications, heroin, and fentanyl. We'll explore how opioids affect the brain, why tolerance develops quickly, and why overdose risk has increased dramatically in recent years. Understanding these mechanisms helps explain why opioid addiction can escalate rapidly and why evidence-based treatment can save lives.